Alrighty, well, we'll go ahead and start here. Good evening, everyone, and thank you for joining our Men's Health webinar. My name is Dylan, and I will be the host for tonight's event. We'll start with a few housekeeping items, and then I will introduce our speaker. First and foremost, your attendance tonight is completely anonymous to the other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, please type it in the chat box feature you see at the bottom of your screen, and we'll be sure to answer them during the Q&A portion of this presentation. The webinar tonight can last for approximately 45 minutes to an hour, and we will be presented by Dr. Christopher Kim of Georgia Urology. Dr. Christopher Kim is a distinguished healthcare professional with a comprehensive background in both pharmacy and medicine. Originally from New Jersey, Dr. Kim began his academic journey at the Rutgers Ernest Mario School of Pharmacy, where he earned his Doctor of Pharmacy degree. He earned his medical degree at Rutgers Robert Wood Johnson Medical School. He attended on a full academic scholarship under the George Smith Endowed Scholarship Trust. Dr. Kim then advanced his training at the prestigious Duke University Medical Center, where he completed his urology residency. With a unique blend of expertise in both pharmacy and urology, Dr. Kim specializes in all areas of general urology, including urologic oncology, benign prostatic hyperplasia, or BPH, complex kidney stone disease, erectile dysfunction, overactive bladder, and urinary incontinence in men and women. Dr. Kim is also fluent in Korean and is very passionate about advancing urologic healthcare access in the Asian American patient population. We have a lot of great content to cover tonight, so Dr. Kim, I will go ahead and turn the stage over to you and have you get us started.
All right, thanks, Dylan. First of all, welcome everybody, and thanks for spending the time to take time to learn about BPH and learn more about the prostate. I want to congratulate everyone that's here because the first step is knowledge and, for investing the time in learning about this disease state. So we'll cover what is the prostate, kind of go over an overview of it, discuss BPH, define it, and discuss our treatment options. So what is the prostate? It's the cause of all wars, right? So it essentially sits in the pelvis surrounded by all these adjacent organs, right? You got the rectum, you have your bladder, you have your urethra. It sits right in the middle between the bladder and encompasses the urethra. It's about the size of a walnut, surrounds the urethra, has a lot of different jobs, including producing the fluid that goes into your ejaculation. In the normal size in a man who's in his early 20s or early 30s, it's about 20 to 30 grams. And then basically, due to biology and testosterone input, it grows and grows and starts becoming a problem in your 40s and 50s and so forth. So what can happen to the prostate? A lot of things, right? So it can be enlarged, like I talked about. You could get cancer and you could have inflammation or prostatitis. What is BPH? So it's an acronym standing for benign prostatic hyperplasia. Keyword on benign. It is not cancerous. It's just an enlargement of the prostate. And when it surrounds your urethra and starts causing obstruction, that's when you start noticing symptoms that we call BOO or bladder outlet obstruction. And that's when you have your symptoms called LUTS. And we're going to define that as lower urinary tract symptoms. So things such as frequency, urgency, slow urinary stream, incomplete emptying. So as I mentioned before, BPH is benign. It is not cancer. It's not a precursor to cancer, and it may even coexist with cancer that's in place. PSA, everyone knows about the PSA. This blood test has been around for more than 50 years, and it's still a good marker of prostate health, right? It's just a number at the end of the day. So it does not distinguish between cancer and benign prostatic hyperplasia. So what is a normal versus enlarged prostate? So the left picture is normal, obviously smaller size. The right picture here is enlarged and it starts causing obstruction. If you see the bladder here, there's a little bit of a narrowing there. So as it enlarges, it puts undue pressure on the bladder, causing those lower urinary tract symptoms that I spoke about before. But the size does not necessarily correlate with the degree of blockage. It's really shape, size, and your other factors that come into play. So I kind of talked about this before, and some of you may experience this right now, but what are the symptoms, right? Sudden urgency to urinate. You urinate and you're not emptying all the way. You have a weak stream, weak flow, right? You have trouble starting, or you dribble at the end of urination, or you pee too frequently, or you have urgency, or you're just not able to go at all. So it's a conglomeration of symptoms that make up BPH. It affects quality of life. The numbers are evident, right? Up to 95% of men with moderate symptoms are just not happy. Urination is something we take for granted, right? We don't think about this until it becomes a problem. Studies have shown that up to almost 50% of men experience sexual side effects associated with lower urinary tract symptoms. And so it does affect your quality of life as well as your partners and your kind of daily routine, um, and other relationships. So who gets it? There's no specific age group that it targets, but you have to be male, right? That's the only requirement. And it is a very common problem in the United States. Upwards as 14 million men have some sort of lower urinary tract symptom. I would probably venture to argue that that is a low number, right? There's undiagnosed BPH probably. It takes a while to go to the doctor. And then obviously as you age and get older, the prostate gets bigger. So you see the statistic by the age of 85, almost 90% of men have some sort of symptom related to BPH. So how is it diagnosed? So we go based off physical exam, which is a digital rectal exam, PSA test, blood test simply put, and then most of it is based on symptoms. Okay, so we go through a symptom analysis using the IPSS score, we call it right here, the International Prostate Symptom Score, and it both has symptom questionnaires about emptying symptoms and bladder storage symptoms, and that's kind of how we differentiate what problem you actually have. And then quality of life, how does it affect your quality of life? It's very subjective. If you're not bothered by it, it doesn't matter if you have a big prostate. If you are bothered by it and you have a small prostate, then so you're going to seek treatment. We do have objective testing as well with the Euroflow or Eurocuff, and then we can scan the bladder after you urinate to see how much urine you have left. That's what the post-void urine volume testing is all about. So what are the options? You can modify behavior, the types of foods, avoiding spicy foods, salty foods, bladder training, medicines, right? So you all know Flomax or Tamsulosin. So medicines, surgical treatment, more invasive, and we'll kind of go into all these options, left to right, less to more invasive. Currently, based on our guidelines for our society and the FDA, there's no specific dietary supplement that is, consistently sponsored. There is saw palmetto that, has been studied prior, but it essentially shows that there is no improvement in symptoms. Some may, feel subjective relief, and I'm not going to stop anyone from using it, but studies have shown that it doesn't actually help at the end of the day. What's watchful waiting? It doesn't mean doing nothing. It means that you're monitoring your symptoms, adjusting your intake, what you put in, what kind of medicines you take, and kind of seeing how your symptoms progress. And then, from here, you'll decide whether to seek treatment, start a medicine, or both. Alpha blockers. So this is what I mentioned, Flomax or Tamsulosin or Terazosin, the similar classes. This class of medicine basically helps relax the muscles around in the bladder and around the urethral sphincter so that your urine can flow more freely, thus in the name Flomax. It's just a medicine that you take daily. You could have some potential side effects. Nothing is free in life, right? You could have some drop in blood pressure, some dizziness. You could interact with other medicines as well. So you're gonna have to, take it with a grain of salt in terms of everything has its pluses and minuses. 5-alpha reductase inhibitors. So this is the medicine called finasteride. Some may know it for hair growth supplementation, right, at a lower dose. What does it actually do? It affects the hormones in your system so that it eventually shrinks your prostate. But studies have shown it takes months, to years for it to reduce about maybe 15 to 25%. It does have side effects to libido, can cause erectile dysfunction, low sex drive, ejaculation issues, as well as some breast enlargement. So, these are not desirable side effects, but for some men it works, then you can certainly take it. Resume. So what's Resume? It's water vapor therapy. So essentially, this is a minimally invasive BPH technology that we use. It can be done in an outpatient surgery center or at the hospital. And we basically have needles that deploy from our Resume scope, and it goes into the prostate. Once the needle enters the prostate, it releases this very hot water vapor to shrink the prostate. So, side effects, as you can imagine, once you introduce very hot water steam into the prostate, you're going to have pain. Some blood in the urine is common. You could have some blood in the semen. You could certainly get a UTI, and have some irritative voiding symptoms. So basically, how does it work? So if you look at the before and after picture here, this is an enlarged prostate, and the needle will deploy both on the left side as well as the right side of the prostate and release its water vapor. And then afterwards, as the prostate heals and sloughs off, you will have an open channel to the prostate. Um, who's happy with it? About 97% of patients would recommend this. Patients are very satisfied at the end of the procedure. Again, you have to kind of, be knowledgeable about the side effects and that come along with it. But at the end of the day, it is a very viable treatment for patients with BPH. So prostatic urethral lift. This is the UroLift. This is no cutting that's involved. It's an outpatient procedure. And basically you put implanted clips and you deploy them onto the prostate, and it pulls apart the prostate so that you no longer have a blockage. Okay. Some of the side effects, as you can imagine, blood in the urine, some pain, irritable symptoms, sort of similar to Resume. It is a minimally invasive technique. In about five years, about 13.6% of patients will require another form of BPH treatment. Green light laser. What is this technology? Using a laser to vaporize the prostate tissue. So this is what I call like a cutting procedure, right? So you're going to use either a hot knife or a laser. In this case, green light laser is very hemostatic, right? You're going to control bleeding very well with the laser, and it's going to vaporize that tissue to create an open channel. Similar side effects, you could have some pain with urination, you could have some bleeding, some scarring that can occur at the end of the day as the prostate heals. There is a better surgical retreatment percentage, about almost 5% in 5 years. How does it work? So similar to the previous picture, nothing really fancy about it. You go in with the scope while you're asleep, and it melts away or vaporizes the tissue, and you have this end result here. TURP. So this surgery, transurethral resection of the prostate, has been around for many, many years and is still considered kind of the gold standard. And what is it? It's a hot knife or a wire that's used to cut away prostate tissue from the inside out. We're coring the apple from the inside out. Similar surgical retreatment rates to green light, a little higher, but similar side effects as well as the green light laser. Simple prostatectomy. So this basically is an intra-abdominal procedure done robotically, where we would core the adenoma or the inside of the prostate that's causing the blockage. We don't get rid of the entire prostate, but we core out the inner portion of the prostate so that we create that open channel. Obviously, this is higher risk because it is an intra-abdominal procedure. We have to make incisions to access your belly and to access your prostate. Um, you could have some bleeding, blood transfusions, but because you are coring out the inside robotically, there is a lower surgical retreatment rate with a little bit of a higher surgical risk of side effects. So iTind, this is another minimally invasive technique called temporarily implanted nitinol device. What is it? You implant a little kind of metal wire deployed into the prostatic urethra, and once you deploy this, it widens the channel, and you keep this in for about 5 to 7 days, then you remove the implant. This is not meant for everybody. It's not meant for people with very large prostates, and it has its place for patients with small prostates that don't want a comprehensive procedure. Aquablation therapy. So this therapy uses high pressure water, almost like power washer for your house, to remove prostate tissue from the inside out. So it uses a combination of the water jet, and once the water jet does its job, to remove the tissue, the urologist would go in with a hot knife or a laser to establish hemostasis, bleeding control, and kind of do any sort of hair cutting that's necessary to create that open channel. Tuna. This is something that was used a long time ago. It is not offered anymore because it doesn't work. So none of us do it. It's just historical, and it used radio frequency ablation to get rid of prostate tissue. So in summary, we learned today about the prostate, what's its purpose in the body and why does BPH occur. So we talked about a lot of, medical options when it comes to medicines, as well as, kind of minimally invasive techniques all the way up to maximally invasive techniques. Thank you so much. This is my QR code if you'd like to make an appointment with me to discuss about your BPH options. And I'm happy to take any questions at this point.